This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into Mon Health Talk. I'm Dave Wilson. Our guest this morning is Dr. Vidya Petla, Mon Health Primary Care. We'll be talking about primary care this morning. And good morning to Dr. Petla. Good morning.
Good morning.
Well, thanks for taking a few minutes. We'll jump into the subject at hand in just a moment. But first, we have to talk a little bit about you. By the way, you're the first guest of 2023, so you have that esteemed honor to put up on your mantle as well. So, but tell us about yourself, your background, where you're from, your education, how you end up with Mon Health. Who is Dr. Petla anyway?
So I went to med school in India. Then I came to United States for better training, education, and opportunities. I went to residency to WVU. Once I graduated, I joined Mon Health with primary care.
What drew you to WVU? You came to the United States for some more training, but how does a girl from India end up in West Virginia?
So I'm from a very traditional Indian background. So they arranged my marriage with a guy who is in West Virginia. So I thought, let me pursue my career here if I'm thrown into the United States.
And you end up with the Mon Health family, and the rest is history, as they say. So what is your, obviously your focus is primary care. What drew you to primary care as a physician?
So primary care, we can divide into preventive care, maintaining chronic medical problems, and, screening people for cancers. So we see healthy patients, acutely ill patients, chronically ill patients. So I'm able to guide them, help them identify. So this gives a fun thought of primary care, and people become your family. Yeah. Once I came into primary care, I noticed that we just don't see them in hospital and discharge them. We become their family. Day or night, we are there, and they call us, leave a message, we get back to them, and they trust us.
Yeah, you really get an opportunity to build long relationships with your patients. And like you said, it's not just treat an injury or an ailment or a sickness in the ER. You get to build long-lasting relationships, and I've heard this from many physicians, Dr. Petla, that can be a very rewarding part of the career.
Yes.
So we're talking about primary care this morning, and this comes up pretty often when we're talking about some of the specialties. Physicians always say, consult your primary care physician, or when we're talking about whether you should do this or that, well, talk to your primary care physician. I know a lot of folks probably think to themselves, well, I don't have one. So let's just tackle that first question. Why is it important to have a primary care doctor?
Yes, as we talked, I think your primary care doctor is quarterback for the medical care team. So that's the first point of contact people have with health systems. You can be healthy. You don't need to have any, many patients come to me and say, hey, I don't have anything going on. My insurance wants me to get a physical. So as part of the physical, we screen for several conditions. We get your blood work. We look at your lipid panel or check if you're diabetic. We screen for colon cancer or a cervical cancer, which are, preventable. Once we find a polyp in your colonoscopy, it can be treatable. Same with the cervical cancer. And I think people need more, that gap needs to be filled more regarding primary care so that more people seek, to come to the clinics and get screened and get their health well maintained. I would say it's like getting your car serviced very frequently. So
That is one of my favorite comparisons. If you take care of your vehicle, you do the preventative maintenance, it'll run and last you for a very, very long time. You kind of treat yourself that way, right, doctor? If you go, you get checkups, you do the preventative maintenance, if you will.
yeah,
You're going to be a lot better off for a lot longer time, right?
I agree with that.
And that kind of brings us to where I wanted to ask you about now. Those yearly screenings that I know a lot of people probably dread. They aren't as bad as they make them out to be, but they are a very important part of that preventative maintenance, if you will.
Yes, they are.
What kind of, and I know each patient's a little bit different, but what is part of a typical routine yearly screening?
So as a part of, definitely we ask like anything acute going on, any changes they have noticed, and we go through their social history, like smoking, alcohol, anything that they're doing differently, and family history-wise. Sometimes if your family history is positive for cancer, for example, colon cancer, thyroid cancer, so we focus on that. Lab work-wise, we check for thyroid, diabetes, lipids, if you have like high cholesterol in your blood, and check for your kidney function, liver function, and check your weight, look at your BMI, if it's changing. People think like, oh, I'm gaining too much weight. Sometimes losing weight is also a problem. So things like that. And physical exam, see if there are like any changes in your ears and your vision screening, your lungs. Are you having any decreased, breathing problems? Just like total physical exam. I think this comprises of annual physical, apart from your pap smears, colon cancer age-based. Once you turn 50, we start screening for colon cancers. This is what comprises an annual physical exam.
Talking to Dr. Vidya Petla, Mon Health Primary Care. When we come back, it's that time of the year where everybody makes those New Year's resolutions to get healthier. Well, maybe some tips on how you can actually keep those resolutions. We'll continue the conversation in a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning is Dr. Vidya Petla, Mon Health Primary Care. We're talking about primary care this morning. And Dr. Petla, it's the time of year when folks make all kinds of resolutions, and if they're lucky, they'll make it through the week. But oftentimes losing weight or just getting healthier is among those New Year's resolutions. So if getting healthier is maybe a resolution, or you just say, hey, okay, it's time for me to get healthier, what are some healthy habits folks can get into here in 2023?
So I think New Year as a continuum of life, the reason is like by end of January, it's like missed opportunity and we have to wait for till next year.
Right.
So I think every day is a good day to make resolutions so that, we can stay healthy and keep going. The good habits I think anyone can form are like hydration. Hydration is understated. I think everyone needs to drink at least 64 ounces of water. When I tell my patients, like, they end up coming back and saying, Doc, now I'm going to the bathroom very frequently. So, like, when you're drinking 64 ounces, like, spread it over the day. Don't gulp all at once. Your body may not be able to process it that well. And for the first week, you will notice that you're going to the bathroom more often if you increase your hydration, but then your body resets. So hydration is one of them, and having well-balanced diet. Well-balanced diet means each meal making sure you have like protein, carbohydrate, vegetables, and some fruits with every meal. And daily exercise, 20 to 30 minutes, whether it be cardio or lifting weights. minimum 20 to 30 minutes. And if you miss a day, it's okay. Come back and do it the next day. I would say baby steps. Don't push through like 2 hours a day. As you said, it may not last the first week. So, and it takes 21 days to make a habit and 66 days to become a second nature. So I would say baby steps, little bit a day, just keep going, keep swimming.
Is that a common mistake? Folks will jump in. So today they'll go out and they'll try to work out for 2 hours, and they'll give up all sweets, for instance, no more sweets, cold turkey, and by the end of the week they're miserable. Is it, like you said, is that a common mistake? Too much, too soon, maybe?
Yes, because we have been doing what we are doing for a long time. It's hard for our brain to perceive like new things. Sometimes even brain can perceive it as a threat. So you need to keep rewarding the brain by doing small things at a time. It will release dopamine in your brain, and it will help you perceive it as a good thing. So once you see good things, you want to keep doing that. It rewards your brain.
What's the benefit to the hydration? I think you said 64 ounces of water a day. What are the benefits to that?
So many patients come to me and say, hey, I'm feeling dizzy, I'm feeling tired. So when I go through the history, they eat like one meal at 11 o'clock, skip the breakfast, or eat one meal at 2 p.m. and barely drink any water. So you need water to, circulate and send nutrients to your brain, to your kidneys, to all the muscles in your body. So keeping hydrated, it gets rid of the, waste that our body produces through urine. So water is again, going back to the car analogy, like your oil. You need to oil your car the same way. You need water for your body.
Is it, now this may be an old myth that I heard somewhere, so you can correct me. Is it true that sometimes our bodies or our brain confuses dehydration for hunger, where we think we're hungry and we want to go get a snack? It's really we're thirsty and we need to go get something to drink. Is that just an old wise tale that I heard somewhere?
It could be possible because water and hunger, there are several other things too. For example, if you're diabetic, you're peeing all day, you're thirsty, you're trying to keep up. And there are several things that can be wrong. Sometimes your kidneys are not functioning and you're thirsty all the time. So there is something called SIADH, where you want to keep drinking and you're not able to keep up. So, but if you take an average healthy person, it could be. It's hard to pinpoint.
That's a very nice way of telling me, nah, I'm crazy. That's what I... We're talking to Dr. Petla this morning, Mon Health Primary Care. Got to squeeze in one more break. We'll continue our conversation in just a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Talking to Dr. Petla, Mon Health Primary Care, talking about primary care this morning. Before the break, we were discussing resolutions, getting healthier, and just want to kind of put a bow on that topic before we move on here in the last couple of minutes. Dr. Petla, you said it takes 21 days to create, create a habit, and then 66 days after that to kind of for that to set in. So what are some tips you can offer so that we probably should count myself in here. When we start eating healthier or exercising or committing to a healthier lifestyle, that we actually keep that up and not just do it for the next 3 or 4 weeks?
So when eating healthy, people think, okay, let me pick all my vegetables. I'm just going to eat salad all day, every day. So people end up having bloating, and they're like, no, it's not that good. So try to balance it. If you eat salad for lunch today, for the evening, try to eat something different. Try to balance it out. As I mentioned earlier, don't make it look like a threat to your brain. Your subconscious brain, it's present all the time. It sees what you're doing. So try to sneak it in slowly. And when choosing, I'm going to eat like all whole grains, all vegetables, all salads, and people end up having, no, I can't do this anymore. So try to balance some grains, some little bit of bread, although bread is bad for you. So balance your meal. That's what I will say. A little bit of meat, a little bit bread, a little bit vegetables, a little fruit, so that there is something your brain likes. One of my seniors in med school told me, when you're preparing for your exams, start from something you like. You will end up doing, well with others. So that would be my biggest suggestion.
Can I every once in a while still have that piece of cake or maybe have a burger every once in a while? Is that okay?
Yes, I mean, as long as that once in a while is, not as frequent. So once in a while, like a week is okay, once in a week.
Okay.
You can tell your brain, hey, this Friday I'm going to get a burger. Yes.
All right. It's all, like you said, it's all about balance and moderation there. We are in the winter months. That means it's going to be up around 60 today, 70 tomorrow. So, for whatever that's worth. But generally it's cold. We're stuck indoors. We're around a lot of folks. We just came off the holidays. What are some tips just to stay healthy while we're kind of cooped up indoors for the next several months?
Sure. So biggest thing, hydration. We mentioned winter, people tend to drink less water, and the indoor dry heat doesn't help any. So maintaining your hydration is the biggest thing. When you go out, try to put your mask on and wash your hands, use sanitizer as frequently as possible. Try to avoid mass gatherings because the flu is rampant. People were predicting flu will be bad after past couple of years of COVID. So we are seeing that currently. So for the winter, staying hydrated, staying indoors, I think this will help you a lot. And one more thing, people who have not exercised much, when it snows, people try to come out to, clear up their driveways. So this is a big thing to, don't do it all of a sudden because people end up having heart attacks.
Dr. Petla, we are all out of time this morning. Great advice. Enjoy the conversation. Have a wonderful day.
104.5 FM.